I'm Gwendolyn, and I have been living with neuroendocrine tumors for about 15 years. I was officially diagnosed in 2021 with stage 4 grade 2 well-differentiated functional neuroendocrine tumors, with the primary was in the terminal ileum, but there was also extensive metastasis, primarily to the liver, where there were innumerable tumors, but also to the duodenum, mesentery, uterus, colon, adrenals. There were a lot. Also lymph nodes. And sort of spoiler alert, I have less of them now, and the ones I do have are smaller, but we'll get to that. So the first thing we started with were somatostatin analogs. It started with octreotide shots. I now do lanreotide shots, but I also had octreotide rescue shots, which initially the carcinoid syndrome was so severe I was doing up to 12 a day. And once I was on somatostatin analogs, we began with surgery. I had a great surgeon who was able to take out the terminal ileum and then also remove my appendix where there was metastasis, as well as some other tumors in the mesentery and the surrounding area, and also some lymph nodes. After that, I was able to move into liver-directed therapies. So I did 2 radioembolizations and 2 bland embolizations. And it was really at that point that I started getting symptom relief from the carcinoid syndrome. And once I was stable from that, then we could go in and really look at the heart specifically. And that was initially a stent, and then I had a full open heart surgery where my pulmonary and tricuspid valves were replaced. So it sounds like a lot, and it was a lot, but it was all done within a 2-year period. My open heart surgery was about 6 months ago, and I am a completely different person. So prior to being diagnosed, I was passing out in public regularly. I was stretcher only. It was very challenging. I really could barely even use a wheelchair in the home. I was bedbound. And now I really have my life back. So I walk, I can jog, swim, sail. It's been incredible. And, I grew up playing competitive sports. I did competitive sailing, and, I knew from that fitness was essential. So, I was the person the morning of even my open heart surgery where I'm like standing up in the, next to my hospital bed, walking in place, holding the octreotide drip. I had a rowing machine in my room. I couldn't walk, but I could row. So I tried to go into surgeries fit, and then, the day after surgery, if I was had my eyes open, I was ringing for the nurse, where's PT? And I loved working with PT and OT. They showed up and they worked hard for me, and I did the same. It has been really important to me to have the surgeons and doctors and nurses and therapists and all of these people show up for me, and I like to do the same for them. So I did the exercises that were recommended. I did the cardiac rehab. And not every day is a great day, but if I look overall, I can see this just incredible improvement in my symptoms. And just like everyone says, go get a NET-specific specialist, it's also been important to get a NET-specific support system in place. One of my best friends set up a Facebook group, so that keeps my friends and family, we're all on the same page. But sometimes I really need to talk to other patients who've been through this, who know the terminology, who have tried the medicine, who've tried the procedures. I have this symptom, is that weird? And I found that 100% in LACNETS. The Zoom meetings have been incredible for me. Their health coach program, sometimes I need some one-on-one support, and that's been there for me as well. And so I think about it, I have this sort of emotional support with LACNETS, with my friends. I have this medical support from doctors like Dr. Del Rivero, but also my endocrinologist and my interventional radiologist. There are so many people who have worked so hard to make sure that I feel supported and safe through all of this. And that's really, at this point, now that, I took care of me and I'm thinking more about other people now, that's what I'd like to give back. I'd like to give the safety net that I've had through this process to others. So, come to LACNETS, come to a Zoom meeting. I'm there. Reach out to me. If I can be of help, I'm here. So, thanks.